Hello friends, myself Dr. Veena's Academic here with new topic from nursing research. So last session we have seen about the overview or nursing process of nursing research, and today we are going to discuss about problem statement, and which is a topmost priority for the nursing student. When we say the nursing research, nursing project which is applicable to JNM student, PBBSc student, BSc student, MSc, and even MPhil and PhD students. So it is a need of each nursing student to know about the nursing research. And today I am with you all on the important topic that is a first or primary or basic topic of nursing research process, that is problem statement. So what is problem statement? First we will see there are different terminology used for the problem statement. Problem statement is called as a nursing research problem. It is called as a statement of the problem. It is called a question, answer to question, or there are different terminology used like a title of the study and all these things. So first we will see definition of problem statement or research statement. So what is definition? Definition given by Curlinger about the problem statement. So problem statement is nothing but it is a sentence. Which type of sentence? It is a sentence interrogative type, or it is a sentence, plain sentence, or we can say the declarative statement or declarative form of the statement is called as a problem statement. When we talk about the interrogative form of problem statement, that is called as a questionable, or it is in the form of question. Interrogative, that means it is in the form of question. And when we see it is a declarative form or statement or sentence form, it is saying very complete statement, that is like it will show the relationship between the different variables. Maybe two or more than two variables will be correlated, or we can see the relationship of both variables in the declarative form of problem statement, or it is said as a in the form of statement. So definition itself says the problem statement is an sentence, maybe in the form of interrogative form, or it is in the form of declarative form, or it is said as a complete plain statement which shows the relationship between two variables or more than that. This was about the definition. For example, like if you take the example of interrogative problem statement, interrogative, that is in the form of question. For example, what is the impact of COVID-19 among nursing students? So this is a question type. Formulation of problem statement is a question type which comes under the interrogative form of problem statement. Second is statement or sentence, or we can say declarative form of problem statement, that is a study to assess. Which type of study? Like quasi-experimental study to assess the effect of hot application on localized pain among adults or among patients admitted in selected hospitals of particular area. So this is a complete statement or complete problem statement which indicate form of declarative or complete statement or complete sentence. This can be written in the form of title also, like effectiveness of hot application on localized pain. So these are the some of the form of problem statement we write. Now we will see about there are different parts of problem statement, or we can say these are the important part of problem statement, or we can say sometime it is a component or aspect of problem statement. Without these, the problem statement is incomplete. There is a difference between the problem statement and title of the study. So when we talk about a problem statement, like for example, it is written in a particular complete problem statement, there is a type of study. Type of study is very important here when we write the problem statement, like whether it is an experimental study or non-experimental study. Under that, whether it is a pre-experimental study or quasi-experimental study, if it is like survey method or descriptive survey method. So first important part of the problem statement is a type of study. Next is a variables. which are, we can say, key or very important aspect of problem statement or even the complete research project. So what is variable? Variable are like, there are maybe types of variable which we are going to see in next session or maybe further sessions. So there are, if it is an experimental study which carries the two types of variables, dependent variable and independent variable. So for example, like we have taken one example, effectiveness of hot application on localized pain. So what is independent variable here and dependent variable? Independent variable is a hot application and dependent variable is a localized pain. So these will be applicable. Independent and dependent variable will be applicable for the experimental study. So what about non-experimental study? Like there are exploratory study, descriptive survey method. There are different types of non-experimental study where there will be only one variable which is called as a researchable variable. Researchable variable, for example, like assessment of stress among the females suffering from chronic diseases. So assessment of stress, that is a stress level, which is a researchable variable. So this is a different variables which is a key part of problem statement. So first what we have seen, type of study which is important, that is the first part of the problem statement. Second part is a variables, maybe for experimental or non-experimental study. Next is a population of the study. Population of study, or which we can say target population or accessible population, which this is also we are going to see in one of the session. So population, that means on which or who will be my sample, that talks about the population. Next, fourth and very important, setting of the study. Setting of the study, where I am going to conduct the study, whether in the hospital, in the community area, what is my area or what is my setting to conduct the study. So these are the four of the important part of problem statement, that is type of study, variables, then setting and population. So next we will see about there are different components of problem statement. What are the components of problem statement that we will see now? So when we talk about a component, which is important part again to formulate the problem statement. So first is a problem identification. Problem identification, that means you need to find out the problem. Where is the problem? What problem you are going to find out and how you are going to find out the solution for that. So identification of problem is very, very important. Like what is the current need of the patient? What is the current need of the community? What is the current need of the society? Depending on, you need to find out or identify the problem. Second is scope of the problem statement or scope of the study. What is the scope of study? Scope of the study, that means like whether if you are conducting one study, how it will be helpful, how it is going to help the patient, recovery of the patient, improvement of the health. So scope we need to find out, whether it is going to help to the nursing profession, whether it is going to contribute for the patient care, whether it is going to contribute for the early recovery of the patient. You need to find out the scope of your study. Third is a background of the study. What is background of the study? That means exactly need. What is exactly need of the study? Why I have to conduct this study? What is the need for this study? So for example, like if you take the example of diabetes mellitus, like prevalence is day-to-day life, we see that the number of cases are increasing of the diabetes mellitus. So I want to do something about a diabetes mellitus. So I need to find out the background of the study. Why I want to select this sample as a diabetes? What I can do for this patient? How I can improve the health, overall health of the diabetic patient, or how I can prevent the complications of the patient with diabetes mellitus. So that talks about the background of the study. So first is we have seen identification of problem, then scope of the study, and then finding out the background of the study. So next component is a knowledge gap. Knowledge gap, that means whether my study is fulfilling the gap of the knowledge, whether it is fulfilling the adding to the knowledge, adding to the skill. So I need to think about the knowledge gap. That is one of the important component of problem statement. So I have to think on the whether it is adding to the knowledge, to the like old studies are there, it is adding to additional knowledge, whether it is giving additional knowledge, that is a knowledge gap. Next is the consequences of the problem statement or consequences of the study. We can say whether it is costing too much, or it is a time consuming, whether it is feasible. So I need to find out the consequences, whether it is harming to the patient also. So I need to rule out or find out the consequences about the study. Next is a proposed solution. If there is any problem, whether after the study, if there is any problem or anything goes wrong, whether I am going to find out the solution, whether there will be a solution that for particular problem. So there are 6 important components of the problem statement. First is a problem identification, second finding of the scope of the study, then next is a background of the study, then consequences, proposed solution, and very important, I need to find out the knowledge gap related to research study and the finding how it is going to help. Now we will see about characteristics of good problem statement. When we see the problem statement, it should be very clear, very transparent. Each terminology should be giving the meaning. So that means first characteristics, it should be very clear, concise statement. Second is it should be evidence based, or it should be based on the previous evidence. That is second characteristics. Third characteristics of the problem statement, it should be very specified, concise. Whatever terms used, whatever concept you have put in the problem statement should be clear, giving the meaning, giving the definition of that. Next, setting should be very clear. Setting of the study should be very clear, where we are going to conduct the study. Population of the study should be very clear, very defined, well formulated problem statement. Next, characteristics of the good problem statement, it should be related to current trends, not like old knowledge, adding to the old knowledge. It should be current based, current need, and currently adding to the knowledge of nursing profession. Next characteristic, problem statement must be very concise, clear, as I said. It should showing the cause and effect. The cause and effect, that is independent and dependent variables, should be very clear, very concise, and giving the meaning of that cause and effect. Then it should be feasible. The problem statement should be feasible to conduct the study. It should be giving concern about the time duration, expenses, and productivity, and solve the problem statement. So this was about the characteristics of problem statement. So friends, today was the second session of nursing research, and we have seen about problem statement, definition of problem statement, then the types of problem statement, that is interrogative and declarative form of the problem statement. Next, we have seen different parts, important parts of problem statement. Then we have seen different criteria for problem statement, good problem statement, and then characteristics of the problem statement. So this was about the today's session, and next session we will have about sources of problem statement and formulation of problem statement with examples. So hope you understood the today's topic.